Hello. Welcome to our podcast, our very first podcast.
My
I'm
first
Bella.
podcast. I'm Miranda.
We are
We're off to a good start.
two, I don't even know what to call ourselves besides two dumb.
Two pretty best friends.
We're two bitty. Just some background on what we're doing. I have VEDS, which is vascular Ehlers-Danlos syndrome, and I thought that in my experiences as a patient, I want to bring forward where we can highlight experiences that people have had with medical professionals, whether they've been good, they've been bad, um, and we read real stories from people that have gone through something. And Miranda
I'm here to
has been with
support.
she has been with me, supporting me through VEDS and everything, and she has good thoughts, Brent. So if you get that, that's cool. We've asked some people to submit stories to us, and we're going to read them and then just kind of get the word out there about how medical professionals are, and maybe we can inspire people to be better when they have these jobs.
Yeah.
Period.
Period. I'm gonna read the first story. It says, "My son with VEDS was six was 6 years old. One morning he had such severe abdominal pain he was lying on the bathroom floor curled up and crying. He told me he needed to go to the hospital. He was in so much pain he was unable to walk. I had to carry him to the emergency room. I handed the ER triage?
Mm-hmm.
Oh, triage
Triage.
nurse, our emergency
Sorry.
exactly. Our emergency card, and they took us back immediately. At first the doctor came right in, and that's where things got bad. That's already making me angry. My son's blood work was all over the place. He was vomiting, had low fever, and he was in so much pain he was crying. It took him it took them almost an hour to get an IV and blood work going. Doctor was sure it was his appendix. I told him I was most worried about a bowel bleed slash perforation.
Yeah.
This doctor said to me, if he had a bowel perforation, he would be dead by now.
Uh,
That was the moment I realized, I know, he realized he had no idea what he was talking about and didn't understand VEDS and the information I had given him. Mm. It took another 2 hours to get an abdominal, 2 hours to get an abdominal ultrasound. At first, he refused to do an MRA, CTA, and totally dismissed me. I called our vascular doctor begging for help. Now, I don't know if it was the vascular team that got him to finally order the MRA or if it was when I was, or sorry, if it was when I went to the ER hall and started screaming at this doctor, and doctors in quotation marks. But 4.5 hours after arrival, we finally got an MRA done. Nothing remarkable showed up, but it still leaves me terrified to this day for if when something were to happen. I was prepared, but even then, you are left at the hands on who who you happen to get help you in the ER
yeah.
when you go.
Oh my gosh.
That's
That is
scary.
scary. Like I can't imagine your little child screaming in pain and they are not taking you seriously.
A little 6-year-old.
I can't even imagine. I would be so pissed. Like start a fire in the hospital.
The part that got my blood boiling was that 4.5 hours after arrival. And then if the doctor is saying if he had a bowel perforation, he would be dead.
Exactly.
Did you even take 2 seconds to research what this is? Are you listening to the mom, or are you just trying to get to
Yeah.
the next
But also
patient?
think
I
about
don't even know. Why do doctors rush?
that exactly. And think about like how the mom's feeling right now. Those are not the right choice of words that they want to hear about their kid
No.
who's going through something that is potentially serious because of VEDS, and then they're
Hmm.
just like, well, he would be dead already. And that's actually a very real thing. He could be dead already, and you are wasting time by not listening to the mom to actually like
Yeah.
look for get scanned for what needs to be done. That is like
What's crazy is that,
go. No, you
go
go.
ahead. No, that's the story. I know for you and for people that you know too. It's why are you in this profession if you're not taking your time for each person? Because, I mean, it can be one less life that is lost if you just took it seriously for 5 extra minutes. Get on your
Yeah.
phone. and
And
Google what
the
it is. Like I
material
can
was
do that.
literally handed to you. You don't even have to do any extra work because it was handed
That's
to you.
right.
Like, you see this and you should be alerted. Already alerted and notified of what to look for.
Hmm.
That is very frustrating.
Yeah. I think there was the final part of it. She says, it's terrifying, and I want to add this was at a level one trauma center slash teaching hospital, and our VEDS expert believes my son had a abdominal inflammation accompanied by a microperforation that didn't show on the scan, and it just healed itself. But he was diagnosed, the doctor diagnosed him with the stomach virus and sent him home.
Ooh,
A
that's
stomach
happened to
virus.
me too, actually, with
I
VEDS.
was going to ask.
It actually happened last year, and it was a month, no, 2 months before my colon perforated. I went to the ER. The CT
Hmm.
scan didn't show any inflammation, apparently, but they diagnosed me with the virus, and they were like, "Go home, get better." And
Is that when you had to go by yourself?
my mom was actually with me that time.
Oh, okay, okay, okay.
And it was even, not to take away from the story, but my cardiologist was like, maybe we should have looked more into things when you
Hmm.
went in that time before your colon perforated.
Yeah.
I do want to add that that is a reality that a lot of people with VEDS go through,
Hmm.
that they are not listened to and not given like full attention from a doctor. And that literally makes or breaks a case, whether it's like the care that somebody receives or the feelings. It makes or breaks a lot of the experience, and maybe that actually prevents people from returning to the emergency room because they know that they're not going
Hmm.
to be taken seriously. It can be frustrating, which can then lead to very serious things happening to people, who should be going to the emergency room.
And it happened so fast, too.
Yes.
When you go to the ER, what do you give them? Because, like, I know, like, you have your medical bracelet, but that must not be enough for them half the time. So, what do you give the doctors?
I honestly don't even wear my medical bracelet anymore
Hmm.
because nobody ever looked at it. And then the Marfan Foundation does have like a printout of emergency room information,
I remember.
but there has been one time where my mom handed it to a doctor and they literally just handed it right back to her without even eyeing it.
Why?
And then it's actually a lot of information to, I don't know. And honestly, what's helped me the most, I don't even say that I have VEDS anymore. I just say like, oh, I have a history of a vertebral artery dissection, or I have a history of like a colon perforation, and that they're like, okay, let's look for more of
Hmm.
this. Whereas I'm just like, oh, I have VEDS, or they don't take that in itself seriously. So it's really hard as a patient because, even as somebody who advocates for this, we're over here like, you should learn about your disease and advocate for yourself and teach doctors and stuff, but it's hard to do that when you're not taken seriously. And then a lot of times, my background in nursing has been what's helped me a lot because they can tell that I'm in the medical profession
Hmm.
and they'll actually listen to me then. And so I really don't know. Like, I don't think there's really an answer for that aside from
Yeah.
medical professionals actually being compassionate and taking the time to hear out their patients, or, really listen to what's going on. All it takes is somebody to listen.
Yeah. And do
So
you think that they don't, like when you say you have vets, like is it not being understood, or is it because they think that people are like overplaying what it is? Why do you think they
I think
don't
it's
take it seriously?
I think it's both. I think that there are other types of Ehlers-Danlos syndrome,
Hmm.
and um, a lot there's a couple types that are a lot more common than VEDS, and that's what they see. So I think when they hear EDS or Ehlers-Danlos syndrome, that's what they think they're treating, which is very real in itself, and it is something that deserves treatment and attention. But the other types don't have the higher risk for organ rupture or artery rupture like we
Yeah.
do. And so I think that because that's not what they're used to seeing, that they kind of get what's the word? Like they see some they get not they get desensitized
Hmm.
because people come in and that's all they hear, that's all they see, and they don't they think it's just like the same old case,
Right.
and they treat the case instead of the person. You know what I mean?
Yeah, that makes sense.
Like, we are told to go to level 1 trauma hospitals. Level 1 is like the highest acuity for,
Hmm.
yeah, for trauma. And so that's where
Top
we're
tier.
supposed to go. So the fact that you're getting disrespect at these institutions is very, unsettling. And they're teaching hospitals. Like what
infuriating.
we think too is that doctors who are learning, who are in the process of, becoming doctors, growing in their careers, you would think that they would
Yeah.
have better like bedside management or bedside care. So,
Mhm.
okay, this one says my son's ophthalmologist, which is an eye doctor. Miranda's gonna become a medical professional
I am.
too. So my son's ophthalmologist brought a medical student in with him to teach him about VEDS in quotes. The first thing that he did was he started to pull on his skin and try bending his fingers to show him his quote unquote loose skin and bendy joints. I corrected him in front of the student. That was not the type of EDS my son has. He was extremely annoyed with me. I still didn't care. You sure can't teach someone else if you don't understand it yourself. Thankfully, he moved away and I found a new ophthalmologist. That is,
I'm glad they spoke on this because I was
yeah.
already thinking
I
about
think
it
that's kind of what you were
before.
alluding to in the other. We're
Oh
talking
my
about the
god.
other one. That is
I
a
was.
very frustrating thing. And it's happened to me a lot of times. Doctors try to pull my skin immediately and it's super tight.
Yeah.
And I'm like, all you're going to do is bruise me, bro. And then even with the bendy joints, like I have a little bit of bendiness. Like but I think your thumb does this
Yeah.
too. Look at us,
Yeah.
two
Probably even
fake
more
best
so.
friends. Yeah, to the
Can you see it?
influencer background. Um, I just have
Yeah.
like I could do this a little bit more than people, but
I mean, like, even so, if I walked into a doctor's office and I said I had X, Y, or Z, and you immediately start poking and prodding at me, like, for what I did not give you
exactly
permission to enter my space. But more so, if I tell you I have this and you're immediately pulling,
for
bending,
what?
why? And that is crazy. I think that was like one of the first things that you had told me. And that is just so frustrating. And then for I think it was the medical student that did it, I think,
Yeah,
if I'm understanding her story correctly. For them to get annoyed with the mom when you're trying to set like a boundary
yeah,
there, that is
and it is
that's wild.
like you said, like you coming in for something, and what does that have to do with pulling my skin and bending the joints? And first of all, like don't even get me started with that
Mhm.
because hypermobile joints or flexible joints can also be found in the general population. So you're teaching them these
Yeah.
symptoms or these hallmarks that you know uh it can oh my god, I don't know where my thoughts are going, but like you're teaching people to look out for these kind of lesser symptoms, um, when they should be looking
Mhm.
for others like more specific cues that this person has this disease. Like, for me, it'd be thin skin, or you can
Yeah.
see my veins. I don't think you can see it on the camera, but you can see it.
Kinda.
Yeah.
Closer
And
to your hand.
so and a lot of the times like my hematologist would do this. He'd bring in a student and we love to teach people about this because it's so rare. And so I think it helps to let the
Mhm.
patients do the leading. Like my mom, he would actually tell my mom, my hematologist, he'd be like, go ahead, like explain what it is. And my mom would be the one, knowing like, this is her skin, her veins are visible here and she has thin skin and all that stuff. So she was the one that was leading that
Mhm.
conversation instead of the doctors that are trying to teach something that they've only read about in medical school or they don't really
Yeah.
see. There reminds me of a meme that was like why are you gonna believe something that you've only seen like in medical school one time, whereas I'm actually living with this, like why
Yeah.
are your thoughts or your mind, why is that superior to like what I'm going through,
Mhm.
yeah,
Right, you're living it. I get like a teachable moment,
we
like
love
by all
education.
means. If I've said like, "Hey, this is something that maybe your medical student can benefit from learning and
Hmm.
what have you," then that's fine. That's what should be happening, but you have to first establish
Yeah.
what is
And
appropriate
don't
and what's
make
not.
the person feel like they're a science project or like they're on display.
I began having sharp cramps on Sunday morning. Since I am diagnosed with VEDS, my husband took me to the ER. After a CTA I was told that I had acute pancreatitis. Is that how you say it?
Yes, it
Okay.
is. Sure.
I stayed the night in our local hospital before I was transported to a larger hospital 2.5 hours on the following day. 2.5 hours away on the following day, Monday. I was not giving any more scans or imaging after the initial CTA, despite my husband telling the doctor I had VEDS and then showing my diagnosis and the treatment letter. The doctor dismissed the letter and told him that was for people who didn't know about VEDS. Okay. I was released on Wednesday evening after the only treatment was NPO. Do you know what that is?
Yes.
Okay.
It's not by mouth. Like they can't take food or drink by
Oh,
mouth
okay.
to like give the GI system a rest.
Okay. That makes sense. On Thursday morning, I was taken back to the local hospital by ambulance after I felt lightheaded and had some slight cramping again. Another CTA was completed, this time revealing my spleen leaking. After
Mm.
waiting to transport and transfer in my local ER for 9 hours, oh my God, my spleen ruptured and required emergency surgery. I was then transferred back to the larger hospital for aftercare. That's scary. What does your spleen
That's
do?
awful.
I can look it up.
It like it helps the body fight like infections and stuff. Like it cleans out
Oh, I
a
didn't
lot
know
of
it could like
the
burst like
blood.
that.
Yeah,
But I
with
guess
VEDS you
really
can have
any of your organs
spleen
can
rupture.
burst,
Yeah, and it's
rupture.
also common to have a splenic artery dissection, like the
Oh,
artery that feeds the spleen.
wow.
So yeah, that is something. So she went in with pancreatitis, which is
Hmm.
inflammation of the pancreas, and I wonder if that like led to causing the spleen to get inflamed because they're on the same side of the body,
Yeah.
and then it caused it to rupture. Oh, that is so frustrating though, because it makes you think like if they had kept her in the hospital, um, that maybe this wouldn't have happened.
Hmm.
And that's exhausting to be going just around like that, hospital transfers, go
Right.
home, go back. And like,
What?
what if they didn't go back?
Yeah, exactly. If they had just played off her lightheadedness. What is a CTA scan?
It's a CAT scan. So they put contrast, well, not
Hmm.
always, but they'll put contrast and then they'll be able to see. So CTA would be like they're highlighting the arteries that are
Right.
in whatever area they're looking at.
Oh,
And
okay.
there is radiation. There's no radiation with MRA scans.
Gotcha.
So that's when they put you on like a little hard bed and
Hmm.
then you go under like the big machine. Can we talk about the doctor dismissing the letter?
That's for people who don't know what VEDS is.
That's the people who don't know what VEDS is. Like I just can't even. I want to know if he truly thought he knew what VEDS was or he just didn't want to like take the time to read the letter.
Right.
But even then, I think as just a person, if somebody is handing me something and it pertains to their life, their health, then I think that I would pay attention to it. You
And
know, it's not like we're printing something off of Google and being like, this is what Google says I have. This is what you need to look for. This is how I should get treated. Like, you are giving them like actual scientific
hmm
information about what this is and what to look out for. Like,
but it's like what you said earlier too. I think with the first story, like everybody's experience with VEDS is different. So it's like I'm not giving you a Google handout. I'm giving you what I've gone through, what
mm-hmm.
surgeries I've had. That's like the first thing they ask you, like when you go to any doctors, like, have you had any surgeries? Do you have a
Yeah.
history of this? Like you should always look at somebody's medical history.
Yeah, you were like, you're being told what to look for and how to treat it.
Mm-hmm.
And to me, the doctor, I think I would be grateful for that information because I know that I'm not going to know everything. And you're
Yeah.
handing me this. And what's wrong with learning a little bit more? You may think you know VEDS already, but things change.
Mm-hmm.
Like research is being done. We're learning so much more about medical care and like what is the 2 seconds gonna take from that, or even
Nothing.
just hear the person out. Like if you don't want to read that shit, Sorry. But if you don't want to read that because you're busy and the ER is crazy, then just take the time to listen. Like,
Real quick.
ask your patient, maybe like summarize this or
Yeah.
something, you know? It doesn't hurt.
No, not at all.
It hurts the patient if you don't do that.
Literally.
So we're gonna go on to the last story for today. This one says, I was taken to an emergency room for having lower back pain. The pain was intense. The ER gave me 600 milligrams of morphine to take the pain away. I told them I had VEDS and I likely had a dissection somewhere. They confirmed on CAT scan that I did have a renal artery dissection. So this is a dissection in the artery that feeds the kidney.
Okay.
They gave me a prescription for pain pills and they sent me home. So they said there was nothing that they can do. 3 days of intense pain, and I went to a different hospital and they took me in and gave me warfarin and kept me for a couple weeks. And these were two different experiences. So, one hospital, they were dismissed, sent home, they were like, just take pain meds.
Mm-hmm.
Second hospital gave them medication, kept them in the hospital for 2 weeks. And I think, as in my opinion, IMHO, that this should always be done with VEDS. I think if somebody's, I mean, you're coming in with the artery tear that feeds the kidney, and you would want to keep them to make sure that the dissection doesn't worsen, especially if it's new, if it's a new dissection, right?
Yeah.
Like you would think that they'd want to make sure that they're completely stable and everything before that they're sent home and just on pain meds.
So let me see if I understood this one. They,
Okay,
the renal dissection, that's what leads to the kidney? Or
yeah, the
yeah?
artery.
Oh, okay,
So that
okay.
artery is the one that had the dissection. Should we explain what a
I
dissection is
think you
versus an
should.
aneurysm? The Your arteries are like tubes, right? Like they're like plumbing. Say this is like your artery tube,
Mm-hmm.
right? So it's open because this is where the blood flows through. So just think of this having an opening. And there's 3 layers. So there's like an inner layer, a medium layer, and an outer layer. So the artery wall. And so a dissection happens when that innermost layer kind of tears off. So
Mm-hmm.
it's kind of like you have a frayed rope, but it's contained inside the artery.
Oh.
And then the blood starts to flow in through that flap. And so dissections can get worse because the blood can continue cause it to tear more and more, and then you have blood flowing through both parts. So dissections are bad because if it's all just like if the flap completely blocks the artery, then there's going to be no
Blood
blood
flow.
getting to that spot.
Oh.
And a rupture is when the artery completely like opens and like there's the wall is completely penetrated.
Mm-hmm.
And then aneurysms are just like a bulging of the artery, so it's like
So it's like
the
it
blood's
gets
just,
caught?
yeah, and
Dang.
it's in there and it continues to flow. And then I just want to bring up that I say she in all of these, but that this person knew that they were having a dissection. Like
Mm-hmm.
people in general who have chronic illness, or we're so in tune with our bodies that we know. And why this is why you should listen to them, to
Yeah.
what's going on.
Nobody
I think
knows
that's the
better
whole
than you
point of
guys.
this. We're gonna hashtag listen.
Hashtag.
That's gonna be our campaign. But
2024.
that's what's so frustrating is like it's like how they say it's free to smile, like it's free to listen.
Oh, per.
That's all you have to do.
I like that. Stick on it.
How
But it
do you
is,
do
though.
this? Going back to that story or continuing with this story, it's just crazy to me how you can have a completely different experience at two different hospitals.
Mm-hmm.
And it kind of circled back to that first story. Like it matters. It depends on who you get.
Yeah.
Like when you go there, because you can have somebody that's willing to bend over backwards and take the best care of you, and then you have somebody that's dismissive and rude. And I just don't get it because people are going there in these very scary experiences. They're having health problems, and I get it. Like they do see people that should not be there, like go to the
Yeah.
doctor, go to urgent care. But I think that even then, it just, how hard is it to just listen to people? How hard is it to just, you know, take the time to get to know your patient? And I
Mm-hmm.
know that's busy, so I don't know what there can be done to fix it. But I think that just taking the time to listen one patient at a time
Yeah.
will make a big difference.
And that's why it's important that you and like I know you have a couple other friends that do like podcasts and videos and they have pages and all that. You guys have it's what is it? It's not the convention. What do you call it that you go to once a year?
Conference.
The conference that you do. And hopefully people like that, like you guys can start being the voice and where people can take it a little more seriously.
Yeah. Period.
Period. Dot.
Thanks for coming to our TED Talk.
Thank you guys for sending in your stories. I know it's a vulnerable spot to put yourselves in. And we want to acknowledge that there's hard work that doctors do to try to understand this, and there's amazing doctors. We're just asking for a little more patience and maybe a little more listening when people go in.
So I had to re-record my closure because I did not get it recorded the first time that Miranda and I did this. But like Miranda said, thank you all for submitting your stories to whoever who did. Thank you for watching the whole of this first episode. We're really excited for this project and we hope to see it grow. We'll start a YouTube channel specifically for this. And if anybody wants to submit stories, you can go ahead and email them to me at investigator@gmail.com. But I'll also include a link with this post, or you can find it in any of my link trees in my profiles. Otherwise, be on the lookout. We hope to do this monthly, and we hope that compassion spreads and that, you guys learn something and have takeaways from these episodes. Thanks.